Yes. I'm trying to see if you can hear me. Huh? Yes. I'm trying to see if you can hear me. Huh? Yes. Trying to see.
Is your set a timer for 13 minutes?
Or are you making noise over there? Huh? I don't know where the noise is coming from.
of an updated safety performance measures developed in cooperation with the NJDOT. You'll be hearing more details on these and other actions later in the committee reports. Today, we'll also consider endorsing the Transportation Capital Program, which has already been approved by the state legislature. It calls for $3.3 billion in transportation investment in our region in the current fiscal year and is the basis for our TIP, which allows our region to draw down federal transportation funding. I know that there are some concerns about specific projects and programs in the capital program. Although the program before us has already been approved, as the region's MPO, we provide a forum where such concerns can be raised publicly and put on the record. In addition, by working with our partners at all levels, the TIP process may be able to address these concerns. Finally, I should note that Election Day was just 6 days ago, and there is a great deal of uncertainty about the direction of the federal government after this national election. But one thing is certain, going forward, we will look to the federal government to help us not only restore the nation's health, but also to rebuild our struggling economy. Our friend Jim Hughes at Rutgers has compared the shape of our economic situation to the Nike swoosh. After a fast and steep decline, we have started up the long trail of recovery, which could take years. Investments in transportation are sure to be part of the federal recovery program. During the Great Recession of 2008, this board played a crucial role in directing stimulus funds for transportation to worthy projects in our subregions and state. We must be prepared to take up a similar role in the near future. And as we do so, we need to pay greater attention to equity concerns, recognizing and addressing the disproportionate burden that low-income and minority communities have faced, both historically and in the current crisis and downturn. I know this board is up to meeting the challenges ahead, and I thank you again for your participation here today. That concludes my report. Do we have any remarks from the NJDOT this morning? Okay.
I'm sorry, none at this time.
What's that?
None at this time, thank you.
Okay, thank you. Are there any remarks from New Jersey Transit this morning?
Good morning again. Just briefly, obviously, we are certainly interested in the outcome of at the federal level. We are, at this point, very heavily engaged and sort of enmeshed in federal funding as support for us. This time for this fiscal year, we have, as I think folks on the call know, relative to most transit properties in the country, we actually have a pretty good fare box recovery ratio during normal times, which is great because it allows us obviously to use our funds for other things and supporting operations. But it's not great when your ridership drops substantially. And while we have seen some return to our services, frankly, as the New York City office market continues to struggle, we are very aware of that, and we've seen that that ridership market has not rebounded, and that's an important component of our market. So we are very heavily, of course, like I said, involved and interested in what happens at the federal level, because the federal support has been critical to our ongoing operations and will be critical to our ongoing operations we know what we've got for this fiscal year ending next summer, but after that, things get a little more opaque. So we are certainly hopeful for some definitive action out of Washington, D.C. Other than that, we do continue to operate our service pretty much full bore across the system, because we do have folks riding. And, I think what folks can see is if you do come back, we've heard anecdotally and through some of our surveys that if you do come back to the system, you will see that things are working pretty well. By and large, the equipment folks are noticing that it's quite clean. We're working, we're continually working with our customers to remind them about, appropriate actions on board. So wearing masks, very important. We really, obviously that's a mandatory activity, but we do of course rely on people's common sense to comply. So as folks are, talking with your constituents or others, again, we would certainly ask for your help in reminding folks that while transit is safe to ride, we do need folks to act in a safe and compliant manner with the directives that have been set out by the state. So appreciate everyone's support, and turn it back to you. Thanks a lot.
Thank you for those comments. Next, we're going to go to our Executive Director's Report. Mary, would you like to start? Thank you.
Yes, thank you, Chair. Good morning, everyone. I want to take a moment to thank Sam Schwartz, who you may know as Gridlock Sam, for joining us today. I look forward to hearing his presentation on COVID-19 and transit. As the chair noted, our staff has been very busy working on a number of different projects and programs. All of them are guided by the Unified Planning Work Program, or UPWP, that was adopted by the board this past March, which was the last time that we met together in person. It's now time to begin to plan the work program for fiscal year 2022, which begins on July 1 of 2021. As we develop this program, we will, of course, continue to reach out to our subregions and to member agencies for input. While the NJTPA staff is still working remotely and will continue to do so until further notice, we have maintained strong collaboration with our state and federal partners, other metropolitan planning organizations throughout the country, and the private sector. This includes sharing our expertise and work at a number of events, including an NJTPA presentation at a recent Federal Highway Administration webinar on communicating the benefits of intersection safety. It's worth noting that FHWA applauded our Street Smart New Jersey pedestrian safety campaign, particularly the periodic evaluations that we conducted to measure the campaign's effectiveness. Also, staff moderated a session on performance-based planning at the Association of Metropolitan Planning Organizations, or AMPO's, virtual annual conference. Central staff also presented at the recent Central Jersey Transportation Forum meeting. And staff continues to work on Together North Jersey, which recently held a round of task force meetings and kicked off a 3-part webinar series on brownfields this month in partnership with NJIT. The next webinar in that series is November 12th, and you can find information about it on our website. We also had a number of staff and board members participate in the first ever virtual transaction conference last month. I'd like to thank our chair, Freeholder DiFilippo, for moderating our live session on public engagement. I also want to thank Freeholders Bartlett and Kenny for moderating pre-recorded sessions on road safety audits and on the NJTPA's freight planning work. While transaction was certainly very different than the live conference that we're used to attending in Atlantic City, over 800 people participated in the virtual event, and about 90 people attended our live session. On the topic of outreach for our long-range transportation plan, I wanted to remind everyone that the next installment of our TPA Tuesdays Symposium series is scheduled for December 8th. You may recall that our first symposium focused on adapting to change. The theme for this upcoming event is enhancing equitable transportation systems. I hope you'll join us for this symposium as we continue our efforts to better address the needs of minority, low-income, and other traditionally underserved communities. You can register at njtpa.org/Plan 2050. You will also find our survey on the Plan 2050 page if you haven't taken it already. I also encourage you to share it widely with your contacts so that we can get as much public involvement as possible. I'd also like to mention one other upcoming event. We are hosting the annual meeting of the Metropolitan Area Planning Forum on December 4th. The MAP Forum brings together 10 MPOs from New Jersey, New York, Connecticut, and Pennsylvania. As the chair previously noted, the NJTPA serves as a forum for collaboration and discussion on a variety of topics. The MAP Forum allows us to work in partnership with surrounding MPOs, helping us to produce products and programs for the larger region. You can register for this virtual event on our website. Finally, I would like to report some good news that we recently received. As you may recall, during our last federal certification review, we were asked to establish a Title VI implementation plan outlining how the NJTPA ensures that we are addressing the needs of minority and low-income communities in our planning work. This board approved a Title VI plan in September of 2019. Upon review of the plan, our federal partners asked us to include additional information on our Title VI monitoring activities and related issues. We provided this draft language to FHWA and FTA, and I'm pleased to inform you that the federal agencies have endorsed it. We will be asking the board to approve the revised and updated Title VI plan at our January 2021 meeting. And that concludes my report. Thank you very much.
Thank you, Mary. Now I'd like to call on Freeholder John Bartlett, Chair of the Project Prioritization Committee, to give the committee report. Good morning, John.
Good morning, everyone, and thank you very much, Madam Chair. I'm pleased to report on the activities of the Project Prioritization Committee. At the joint committee meeting in October, the committee considered 8 action items, all of which are on today's agenda. First, the committee recommended endorsement of the state's fiscal year 2021 Transportation Capital Program. As the chair noted, this program provides the foundation for NJTPA's Transportation Improvement Program, or TIP. Last month, the capital program and a summary of changes to projects was provided to members of the Project Prioritization Committee and RTAC for their review. The 2021 program includes nearly $3.3 billion for investment in the NJTPA region, out of a total of $4.6 billion statewide. This includes $2 billion in NJDOT projects and programs and $1.3 billion for NJ Transit. While the committee recommended endorsement of the capital program, which is listed as action item 1 on today's agenda, I should note that some subregions expressed concerns about the inclusion or omission of projects and funding in the program. At the October meeting, the committee also considered the list of projects proposed for the 2020 Local Safety and High-Risk Rural Roads programs. The committee recommended approval of 11 local safety projects totaling $71.2 million and 2 high-risk rural roads projects totaling $25 million. All of these projects were screened and recommended by an interagency technical review committee. I should note that this action represents a substantial increase in funding for these programs. The NJTPA is committed to working with NJDOT and our subregions to deliver these projects over the next several years. This is listed as action item number 2. Next, the committee endorsed a minor amendment to the current TIP to add the Route 15, Route 94 to Route 206 County Road 565 project in Sussex County. This resurfacing project is ready for construction in the current fiscal year and can move forward with this addition of $7.2 million in federal funds. This is listed as action item number 3. Next, for action items number 4 through 8, the committee endorsed 5 minor amendments to add locally led projects to the TIP, so that they can advance to the preliminary engineering phase of work. Funds for these projects are available from the NJTPA Future Projects line item. The projects and their funding levels are County Road 510, Columbia Turnpike Bridge over Black Brook project in Morris County, $400,000 in fiscal year 2021 for preliminary engineering, and $6.3 million for additional work in later years, including construction in fiscal year 2024. The East Anderson Street Bridge over the Hackensack River in Bergen County, $1.9 million in fiscal year 2021 for preliminary engineering, and $41.1 million for additional work in later years, including construction in fiscal year 2026. The Kingsland Avenue Bridge over the Passaic River in Bergen County, $1.5 million in fiscal year 2021 for preliminary engineering, and $37.7 million for additional work in later years, including construction in fiscal year 2026. The County Road 567 Pickett Place Bridge over South Branch of the Raritan River project in Somerset County, $1.4 million in fiscal year 2021 for preliminary engineering, and $11.6 million for additional work in later years, including construction in fiscal year 2025. And finally, County Road 512 Valley Road Bridge over Passaic River project in Somerset County, $1 million in fiscal year 2021 for preliminary engineering, and $8.1 million for additional work in later years, including construction in fiscal year 2025. Again, these 5 minor amendments are listed as action items 4 through 8 on today's agenda. I want to thank PPC Committee Vice Chair Jason Sarnowski for running October's meeting in my absence. And with that, Madam Chair, I conclude the Project Prioritization Committee report.
Thank you, Freeholder Bartlett. Before we move to the endorsement of the draft fiscal year 2021 Transportation Capital Program, I just, in the interest of simplifying our board action for this online meeting, we've asked some of the board members to be prepared to offer a motion and a second. I understand that Middlesex County would like to move this particular item.
Yes, Charlie Kenny, Middlesex County would like to make a motion to move item number 1.
Thank you. And Hudson County, would you like to second this item?
Yes, Hudson County seconds.
Thank you. Any comments from the board members?
Freeholder, Warren County Freeholder Sarnowski would like to comment.
Yes, please, Freeholder Sarnowski, please do comment.
Thank you, Board Chair. I'd like to begin by first thanking you, Board Chair DiFilippo, and Prioritization Committee Chair Freeholder Bartlett on your bipartisan way you support the regional organizations and address the concerns that are brought up by the regional organizations. As you noted, some of the regions did have concerns. I was one of the regions that had a concern regarding the endorsement of the TIP, the Transportational Capital Program. I continue to oppose the capital program in its form, mainly for the reasons of 2 projects. One, the 519 and 57, which we continue to work through, although certain benchmarks continue to be delayed, which bring me great concern. We have meetings coming up in the near future regarding those. And I thank the DOT for their work in continuing to try to work through those issues with me. But until those issues are resolved, I'm going to continue to, be a vocal support of my region regarding that project. And secondly, the Route 80 Rockfall Mitigation Project, which myself and my region continue to have many issues with parts of that project. And still do not feel that we have adequately answered a lot of the concerns and questions we have with regards to that project. So I continue to bring focus to that project as well. But thank you for allowing me this time to speak about that. And I appreciate all that you do for our region.
Thank you for your comments. Before I ask for a roll call, are there any members of the public that would like to comment on this item? Ted, do we have anything in the chat box?
No, Chair, not at this time.
Okay.
Hunterdon County would like to speak?
Okay, go ahead, Hunterdon County.
Thank you very much, Freeholder DiFilippo. I would like to take a moment just to comment on Freeholder Sarnoski's comments. We will be supporting this, but I would also add that there are two Rockfall projects that fall in Hunterdon County, one of which is on Route 78, and there's another one down on Route 29. And we joined together with Warren County in looking for sensible solutions, both from a cost perspective as well as an impact perspective, to all of these rock mitigation projects. Thank you for the opportunity.
You're welcome. Is there anyone else that would like to make a comment? Hearing or seeing none, Beverly, will you please take a roll call?
Bergen,
Yes.
Essex,
Yes.
Hudson,
Yes.
Hunterdon,
Yes.
Jersey City,
Yes.
Middlesex,
Yes.
Monmouth,
Yes.
Morris,
Yes.
Newark,
Yes.
Ocean,
Yes.
Passaic,
Yes.
Somerset,
Yes.
Sussex,
Yes.
Union,
Yes.
Warren,
No.
Governor's
Yes.
NJDOT,
Yes.
NJ Transit,
Yes.
Port Authority.
Yes.
The motion is carried.
Thank you. Next, we're going to move to the approval of projects for the 2020 Local Safety Program and High Risk Rural Roads Program. And I understand that Passaic County would like to move this item. Freeholder Bartlett, are you there?
Yes.
No, I'm
Thank
sorry.
you. That's no problem. Passaic moves. Passaic moves.
Thank you. And Freeholder Bartlett, I believe you want to second this motion?
Yes. Who just moved it?
Okay, I'm sorry, I'm I coursed here, and somebody was second it. Was it David Antonio?
Yes. Essex seconds.
Thank you very much. Any comments from the board before we move to the public? Hearing none, is there anyone from the public that would like to comment on this particular item? Hearing none and not seeing anything, Beverly, would you like to do the roll call?
Certainly. Bergen,
Yes.
Essex,
Yes.
Hudson,
Yes.
Hunterdon,
Yes.
Jersey City,
Yes.
Middlesex,
Yes.
Monmouth,
Yes.
Morris,
Yes.
Newark,
Yes.
Ocean,
Yes.
Passaic,
Yes.
Somerset,
Yes.
Sussex,
Yes.
Union,
Yes.
Warren,
Yes.
Governor's Office,
Yes.
NJDOT,
Yes.
NJ Transit,
Yes.
Port Authority?
Yes.
Motion is carried.
Thank you again, Beverly. In the interest of further simplifying our board actions for this online meeting, we will act on the following 6 minor amendments together as one. If there is anyone who prefers that we take one or all of the following items separately, please speak up. Okay, hearing none, I understand Sussex County would like to move this item.
That's correct. Thank you. Sussex County, Josh Hertzberg moves.
And a second,
Warren County, Jason Sarnoski will make the second.
thank you. Any comments from the board members? Hearing none, are there any comments from the public on these items? Hearing none, Beverly, will you please do the roll call for action item forward? Thank you.
Yes. Bergen?
Yes.
Essex?
Yes.
Hudson?
Yes.
Hunterdon?
Yes.
Jersey City?
Yes.
Middlesex?
Yes.
Monmouth?
Yes.
Morris?
Yes.
Newark?
Yes.
Ocean?
Yes.
Passaic?
Yes.
Somerset?
Yes.
Sussex?
Yes.
Union?
Yes.
Warren?
Yes.
Governor's Office?
Yes.
NJDOT?
Yes.
NJ Transit?
Yes.
Port Authority?
Yes.
The motion is carried.
Thank you again, Beverly. So we went through the minor amendments of 3 to 8. Next, I will call on Freeholder Jack Kelly, Chair of the Planning and Economic Development Committee, to give the committee report. Good morning, Jack.
Good morning, Chairman, and thank you. I'm pleased to report on the activities of the Planning and Economic Development Committee. At the October joint meeting, the committee considered 3 action items. The first concerns the annual update to the required safety performance measure targets for the region, which were first adopted in 2017 as required by federal law. The NJTPA coordinated with NJDOT, the New Jersey Division of Highway Traffic Safety, and the other New Jersey MPOs to analyze trends and set targets for 5 performance measures set by the Federal Highway Administration. These safety performance measures include the number and rate of fatalities, the number and rate of serious injuries, and the number of non-motorized fatalities and non-motorized serious injuries. The committee was informed that due to a new expanded federal definition of serious injuries established in 2019, it is difficult to gauge the region's progress in reducing injuries. Overall, the NJTPA region has seen a reduction in the number and rate of traffic fatalities. With this action, the NJTPA will agree to plan and program projects that support the attainment of the state safety performance measure targets for 2021. The NJTPA continues to accomplish this goal through its local safety and high-risk rural road programs, Street Smart New Jersey, and many other safety programs. This is listed as action item number 9 on the agenda. The next 2 action items concern approval of federal congestion management air quality, known as Cmax, CMAQ, funding for locally sponsored projects aimed at reducing air pollution and congestion. First, the committee recommended approval of the fiscal years 2021 through 2023 Cmax funding for the Transportation Clean Air Measures Program, also known as TCAMS. In coordination with NJDOT, the NJTPA is recommending a total of $20.6 million for 11 TCAM projects to be implemented by member subregions as well as 3 municipalities, a transportation management association, a state agency, and 1 private company. These funds will go toward implementing zero emissions goods movement, reducing emergency vehicle idling, providing electric vehicle charging grants, making trail and path improvements, optimizing traffic signals, and purchasing electric buses. The recipients include Essex, Monmouth, Morris, and Passaic counties, the municipalities of Patterson, Union City, and Weehawken, the Easy Ride TMA, the New Jersey Department of Environmental Protection, and International Motor Freight. Details on all these projects can be found in today's meeting package. This is listed as item 10 on today's agenda. The final action item involves approval of fiscal year 2021 Cmax funding for the Local Mobility Initiatives Program. This program supports local shuttle bus operations and vehicle replacement. In coordination with NJ Transit, the NJTPA staff recommends 4 projects for implementation, totaling $1.8 million. 3 of the recommended projects are for vehicle replacements for the Sussex County Skylands Ride Program, the Borough of Fort Lee's Ferry Access Service, and shuttles operated by the City of Orange Commuter Transportation Project. The 4th provides operational support for the Jersey Blues line sponsored by Brookdale Community College in Monmouth County. Approval of these 3 local mobility initiatives is listed as Action 11 on today's agenda. In addition to these actions, the committee heard a presentation by Khalid Sheikh, I hope I pronounced that right, New Jersey DOT Project Manager for the development and implementation of the New Jersey 2020 Strategic Highway Safety Plan. This data-driven, performance-based 5-year plan is designed to reduce fatalities and serious injuries on all public roads in the state. Emphasis areas in the plan include equity, lane departure, intersections, driver behavior, pedestrians and bicyclists, and other vulnerable road users. In addition, NJTPA staff informed the committee that NJDOT has submitted the NJTPA Cmax Performance Plan to FHWA as part of its mid-performance period progress report. This plan demonstrates the region's progress on 3 federally required performance measures, 2 dealing with congestion, and 1 concerning the reduction of vehicle emissions. The NJTPA's plan shows that targets for these 3 measures have been met, and it also provides a list of upcoming CMAQ projects and discusses their part in improving air quality. Finally, central staff provided updates on recent activities, including planned 2050 outreach, Title VI planning, and the fiscal year 2022 UPWP development schedule. Thank you, Madam Chair, and that concludes my report.
Thank you. Before we go forward with action item number 9, I just sort of remind everyone to keep their phones on mute or computers on mute so that there's no background disturbance. Action item number 9 is support for the 2021 safety performance measures targets set by the NJDOT in collaboration with the NJTPA and other MPOs in New Jersey. I understand Passaic would like to move the item.
Yes, Madam Chair. Passaic moves item number 9.
Thank you.
And Ocean County will second.
Thank you very much. Are there any comments from other members of the board with respect to action item 9?
Yes, for the city of Newark. It's probably for a DOT. I just want to know the status of Newark's Cmax funding for its ITS projects. It's been some kind of discrepancies over it. I just kind of want to clear that up to see where we're headed towards that. You know, are we still in the runnings for it, or just where it's at?
Beverly, can we have a roll call?
I think that's for action item 10, I was going to say. That comment.
I'm sorry, there's someone who wanted to make a comment?
Yeah, Trevor Howard, I just was clarifying that I think he was commenting on action item number 10.
Okay, thank you.
Okay.
Roll call.
Bergen,
Yes.
Essex,
Yes.
Hudson, Hunterdon,
Yes. Hudson.
okay. Jersey City,
Yes.
Middlesex,
Yes.
Monmouth,
Yes.
Morris,
Yes.
Newark,
Yes.
Ocean,
Yes.
Passaic,
Yes.
Somerset,
Yes.
Essex,
Yes.
Union,
Yes.
Warren,
Sorry about
Warren.
that. Yes, yes.
Governor's Office,
Yes.
NJDOT,
Yes.
NJ Transit,
Yes.
Port Authority,
Yes.
motion is carried.
Thank you again. Action item 10, approval of fiscal year 21-23 congestion management air quality funding for the Transportation Clean Air Measures Program. Do I have a motion?
Yes, Byron Nicholas, Hudson County will move this item.
Thank you, Byron. And a second?
Yes, Terry O'Connor from Monmouth.
Thank you, Terry. Any comments from members of the board? Hearing none, we'll move to any comments from members of the public on this item. Okay, hearing none, Beverly, would you please?
Okay. Bergen,
Yes.
Essex,
Yes.
Hudson,
Yes.
Hunterdon,
Yes.
Jersey City,
Yes.
Middlesex,
Yes.
Monmouth,
Yes.
Morris,
Yes.
Newark,
Yes.
Ocean,
Yes.
Passaic,
Yes.
Somerset,
Yes.
Sussex,
Yes.
Union,
Yes.
Warren,
Yes.
Governor's Office,
Yes.
NJDOT,
Yes.
NJ Transit,
Yes.
Port Authority,
Yes.
Motion is carried.
Thank you again. And our last action item this morning is the approval of the fiscal year 21-23 funding for the local mobility initiatives. Do I have a motion?
Sussex County, Josh Hertzberg makes the motion.
Thank you. And a second?
Terry O'Connor, Monmouth County, seconds.
Thank you again, Terry. Any members of the board that wish to comment on this item? Hearing none, I'll move to the public. Is there anyone that wishes to comment on action item 11? Hearing none, Beverly, I'll ask you to do a roll call on action item 11.
Okay. Just a note, road work is beginning right outside my window right now. If you hear any extraneous noise. Here we go. Bergen,
Yes.
Essex,
Yes.
Hudson,
Yes.
Hunterdon,
Yes, and I might add, Beverly, that apparently you have quite a tie or something that gets you road work done that quickly.
Yes, but I can't share my secret. Jersey City,
Yes.
Middlesex,
Yes.
Monmouth,
Yes.
Morris,
Yes.
Newark,
Yes.
Ocean,
Yes.
Passaic,
Yes.
Somerset,
Yes.
Sussex,
Yes.
Union,
Yes.
Warren,
Yes.
Governor's Office,
Yes.
NJDOT,
Yes.
NJ Transit,
Yes.
Port Authority.
Yes.
Motion is carried.
Thank you again, Beverly. And I have to say that we at the NJTPA do appreciate hearing road work in the background, or in my case, sometimes it's the train with the whistle. So in any event, next we're going to move on to our freight initiatives. And Freeholder Charles Kenny, Chair of the Freight Initiatives Committee, will give that report. Good morning, Charlie.
Good morning, Madam Chair. Good morning, everybody. I'm pleased to report on October 21st, we had our Freight Initiatives Committee meeting. Central staff informed the committee that the NJTPA is working with the council on port performance, on a workforce development implementation team to address the workforce shortages that are challenging operations as the port sees a rise in container activity. August saw more containers in 1 month at the port than ever before. That was soon followed in September by the arrival at the Port Newark Elizabeth of the Brazilian vessel that is now the largest to ever serve the port. Staff also informed the committee about developments in the area of industrial real estate, noting that the region's portfolio of industrial properties continues to grow, reaching 851 million square feet during the third quarter. E-commerce remains a huge driver of this activity, as does the food industry. So with that in mind, our guest speakers focused on two critical supply chains, pharmaceuticals and food. They discussed how these industries responded during the pandemic and how they are pivoting based on the changing demands and requirements. Our first guest speaker was Ronald T. Pierfensenzi, Chief Executive Officer, United States Pharmacopoeia, or USP, which sets quality standards for medicines worldwide. He briefed the committee on international prescription drug supply chain, which extends from ingredient suppliers to manufacturers, to wholesalers and distributors, to providers, and then the patients. He noted that quality issues are the root cause of drug shortages, along with increased demand, natural disasters, regulatory and logistic hurdles, to name a few. In response to the COVID-19 pandemic, USP created an early warning system tracking 1 million medicines worldwide in order to identify supply chain risk. It has also created a team to reach out to COVID-19 vaccine manufacturers globally to let them know of the availability of USP standards and technical expertise to help them meet regulatory requirements. Next, we were joined by Linda Dougherty, President and CEO of the New Jersey Food Council, who briefed the committee on trends affecting the New Jersey food and grocery supply chain. The council is an alliance of food retailers and their supply partners, representing a $136 billion industry. In response to the COVID-19 crisis, the state of New Jersey assembled a food supply chain working group that includes food council members and representatives from the governor's office, several government agencies, the New Jersey State Police, Conrail, and NJTPA. Ms. Dougherty said in the early days of the pandemic in New Jersey, the entire supply chain was disrupted by workforce challenges and shortages. These operations are seeing an uptick in COVID-19 cases, and self-quarantine is causing operational disruptions of a workforce whose positions are difficult to fill. Ms. Dougherty said the food industry supply chain has stabilized significantly, but is still challenged by gaps in product availability. And while things are improving, there are still many issues along the supply chain that will not end soon. She did say, however, that the New Jersey Food Council is now better prepared for future developments. Also at the meeting, committee members provided brief updates on freight-related activities. NJTOT is starting the process for the New Jersey statewide freight plan update. Applications for the Rail Freight Assistance Program have closed, and grant process is underway. And there will be a virtual freight advisory committee meeting on November 19th. The Port Authority is seeing a slight uptick in cargo at the airports, while passenger volume is still down. Traffic volume continues to rebound at the bridge and tunnel crossings. New Jersey Transit will begin work on the New Jersey State Rail Plan in collaboration with the NJDOT. A new Hudson County study will assess freight in the county with a focus on truck. The city of Newark has begun work on its port industrial redevelopment plan that will focus on infrastructure, land use, community satisfaction in the port industrial area. This concludes the Freight Initiatives Committee report, and I want to thank Ann and Jacob for all they do to make this a productive meeting every other month. Thank you.
Thank you, Freeholder Kenny. And now we're going to move to our key discussion item, Planning for 2050 presentation. Sam Schwartz, known by many as Gridlock Sam, will give a presentation on COVID-19 and transit. He is a professional engineer and founder and CEO of Sam Schwartz Firm. Sam, good morning. Thank you for joining us today.
Good morning, Madam Chair. It's a pleasure, and thank you for inviting me. And I know Melissa Hayes will be assisting me today in changing the slides. This is the result of about 6 months worth of work by a team of researchers at my firm who reviewed the scientific literature and also interviewed virologists, epidemiologists, public health experts around the country and around the world to get a handle on the science of COVID-19 and transportation. So Melissa, if we can move to the next slide, please. We know in this area that transit usage is, the decline is an existential threat to the region. And we have seen an estimate by NYU just a couple of weeks ago that this continued decline could result in a loss in the region of 450,000 jobs, 50 billion in annual earnings, and 65 billion in the region's annual GDP. So we know this is quite serious, and we need to have some science as we go forward, and the public needs to understand the situation with transit next. And what has happened in terms of ridership at the various modes? What we have listed here in order of impact are the various modes in the region. The airports have gotten hit the worst, along with New Jersey Transit Rail at 98%, the MTA commuter rail, and you can see all the commuter rail services have been hit significantly. PATH at about 95%, New Jersey Transit at 93%, and this is during the peak of the epidemic. And if we look at the recovery with the most recent data, we could see that there has been some recovery, but rail is far behind traffic, general traffic. If you look in the bottom in terms of the region's bridges and tunnels during the worst, they were hit with a 64% reduction in volume. They're now at about 90% of normal volumes. And in the case of trucks, they're at 100% of normal volumes. And we just heard from the freight report how much activity there is at the port. So we have a long way to go, particularly with our transit services, and a lot of that has to do with fear that may not be based on science, as you'll see. Next. And I just want to talk a little bit about equity, because a number of you did speak about equity, and it was very good to hear. As this region progresses, we need to be concerned with all citizens of this region. And in the very beginning of the epidemic, we hailed our heroes, the people that were driving the transit system, the emergency workers that were responding to us in need, the storekeepers that were there for us to get our food, the contact tracers, the delivery people, the pharmacists, they were all there. We hailed our heroes. But then at the same time, next slide, please. No, I'm sorry. One more slide. Yes, but then we discriminated against our heroes, and we cut the service they rely on, public transit. We didn't do that deliberately, but local and national policies discriminated against transit users, and ergo low-income people. For example, the New York Stock Exchange prohibited transit riders from the trading floor initially until June 15th. And offered discounted parking fees and continues to do that. Even the CDC advised business owners like myself, we should advise reimbursements for people to drive alone, not even carpool, drive alone. And just recently, last month, a major New York real estate firm that has directed all its employees to return said, in return, we will pay for your parking, half your monthly parking. And a fifth of the employees are using that. And then we cut public transit services. Next. So why? And a lot had to do with irresponsible research and reporting. Researchers couldn't wait in the very height of the epidemic when it first hit to explain it. And we should always be wary when people try to explain things immediately. And immediately there were a series of articles, there's just one from MIT, that the subways seeded the massive coronavirus epidemic in New York City. Not done by a scientist, by the way, but I liken that to, it's like saying ice cream causes drowning. We know the epidemic hit the New York region very hard and hit it in the early days. And so people trying to explain, well, what's different with New York and New Jersey versus the rest of the country? Well, it's our reliance on transit, so it must be transit. But that, in Statistics 101, you learn about the ice cream and drowning correlation. They both peak during the summertime, and you learn not to make the mistake of saying ice cream causes drowning. Well, that's the mistake that was made back in April, and that has stuck with us. By May, the New York Times was saying cars are protecting Los Angeles. Well, if you look at the graph below, you could see, yeah, it looked that way back in March and April, but then Los Angeles took off and exceeded New York City region in cases on that. And soon the New York Times followed that up by, is the subway risky? It may be safer than you think. And in fact, it turns out to be safer than most people think. Next slide. And so we began during the early days of researching by zip codes in the New York City area and then looking in the suburban communities in the region. And we found that the transit usage zones, and we excluded Manhattan because many people were leaving Manhattan, or Manhattan was a wealthier borough with better access to health services and other things. So we excluded Manhattan, and we found in the boroughs, the 10 zip codes that used transit the most had a lower case rate than the ones that used transit the least. Staten Island, which is our borough that has the highest, has no subways, and has the highest auto usage, was 50% higher than Manhattan and even 28% higher than Brooklyn. And the 10 highest case rates, 57% households had cars, and the lowest, only 21% had cars. And there was really no difference in the highest case rates, the lowest case rates in terms of transit usage. So something else was going on, and we weren't about to make the ice cream mistake and say it was cars causing it. Next slide. And when we looked at the region, and on the left, you'll see the New York suburban counties. And if you look at the first line in the text, most suburban counties had a higher infection rate than New York City. And this is during the peak of the epidemic, which New York City had 3,073. I think this is now as of October 20th, but it was true during the peak. Rockland, Westchester, Nassau, all the ones in red had a higher case rate. And when we looked at the top 5 on the New Jersey side, Passaic, Union, Hudson have higher case rates than New York City, and Essex and Ocean below that. Next slide. And so that began our work, which we had been doing for a number of months before the American Public Transit Association, Transportation Association, teamed with us to do a report on public transit and the COVID-19 pandemic. And so during this process, as I said, we interviewed epidemiologists, virologists, we studied the scientific literature. And while I'm not a medical professional, I am trained in science and physics and in engineering. So I interpret that as a scientist, the work that we've done. Next. And what we found in health experts that did look at transit, and there's been very little of this in the United States, scientists looking at transit specifically, looking at contact tracing around the world, and these are just 4 that I cite. Paris, 0 of 150 case clusters during the peak of the epidemic there in May, June, and I'm sure they're going to be doing one now as we see peaking again in Europe. Austria, 0 of 2,400 case clusters. In Japan, which continued to have crowded rail systems, and they did exhaustive contact tracing, not one infection was traced to the country's rail systems. The same thing in Hong Kong, no outbreaks connected to transit. Next. And when we looked in the New York City, we looked at the subway system as it began to return. And between June 1st and September 12th, more than 212 million rides were taken on New York City subways and buses, yet the positivity rate dropped 55% from 3.3% to 1.5%. So something was going on, and we looked around the country. Next slide. And we found no correlation in every city that we followed. In some cases, ridership went up, COVID went down, ridership stayed steady, COVID went down or up. It had nothing to do with transit ridership. Next. And when the explanations and interviewing a number of scientists and virologists and others, what were the explanations for the lack of correlation? Well, first of all, everything that I'm talking about presupposes the use of masks on transit. So I'm talking about transit where people are using masks, which is what the contact tracing that I spoke about involved. They pointed out to a very interesting thing, and that is we don't talk very much when we're on transit. And that's a huge benefit because talking expels viral particles, if someone does have the virus, much further than just breathing. And if you're wearing a mask, others are wearing masks, the probability of a viral particle escaping your mask and then getting through another person's mask, first of all, will be much fewer than if you're talking. So there's little probability because people don't talk much and they're just breathing on transit. There's also enhanced airflow, and I'll talk a little bit about ventilation systems, but the frequent stops in urban transit in particular are very helpful, and the short duration. And exposure to the virus, if you look at a number of the studies, they talk about minimum of 15 minutes, but they're really much of the studies that were done in which there have been contact tracing. People had spent hours with other people that were infected at restaurants, gyms, and other places. Next. And so this is one of the virologists that we studied his work, Dr. Hitoshi Oshitani. He found that there was the evidence points to concentrated environments with a strong social elements such as bars, clubs, indoor restaurants, houses of worship. Gyms are also, I would add to that. And his team did not trace any clusters, again, to Japan's commuter trains. Riders are usually alone, not talking to others. And his quote is, an infected individual can infect others in such an environment on trains, but it must be rare. They haven't been able to find it. Next. And the ventilation, this is the ventilation for the New York City subway system, which is 18 times an hour. The recommendation is for 12 times an hour for medical isolation rooms. The subways exceed that, and the subways, of course, open doors with great frequency. So that adds to the ventilation, and you could see for offices, it's 6 to 8 times an hour, and classrooms 3 to 4 times an hour. So you can see fairly high. We've been unable to get some ventilation rates from New Jersey at this point. Next. And masks, I can't emphasize it too much on this, and this is from the CDC director when he was testifying before the US Senate, said, I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine. Nonetheless, we should, once the science demonstrates COVID vaccines are safe, please take COVID vaccines and please continue to wear masks. Next. So when we look at regions around the country, we find that our region isn't even in the top 10, isn't in the top 50, isn't in the top 100. In fact, it's number 148, the New York City metropolitan area. And when you look at areas that are in the top 10, none of them have much transit ridership. Gallup, New Mexico, El Centro, California, Yuma, Eagle Pass, and you could see the list. By the way, I'll make this presentation available to NJTPA and for its members and anybody else that asks. Next. And so one of the conclusions that we have is it's not how you travel that affects whether you're contracting the virus or not, or the probability of contracting. What we found in the very beginning, and a lot of that data I showed you at the very beginning, it didn't matter whether people traveled by car or transit. Many of the people that traveled in the early days were essential workers, and it's what they did, and they had more associated risk at the beginning, and that's why we saw that big rise in the very beginning. It didn't matter whether people were driving cars, as they were in Staten Island, and getting and there was a high rate of virus transmission there, or if they took trains and they were essential workers. Next. And we can't forget that if we develop policies, and I know this is part of the NJTPA 2050 discussion, as we go to the future, we can't make the mistake, as that headline did in the New York Times, saying cars saved LA. We know cars, and this chart shows you, cars are 20 times more dangerous in terms of the probability of a fatality per passenger mile than trains or subways or buses, even more so. And we know that there are other secondary impacts of taking our region going from heavier reliance on trains to heavier reliance on cars, the additional pollution, the increase in inactivity diseases, and the acceleration of climate change. And that next slide And that concludes the presentation, and happy to take questions. And again, we'll make this available to anybody and certainly to the NJTPA.
We do have a question. Let me just read this for you. Neil is asking if you can comment on the safety of bus versus train travel and subway versus regional rail. He's also asking about whether the age of the rolling stock affects the adequacy of their ventilation systems.
Okay. Local buses frequently open their doors, and the ventilation systems vary on the buses from very good to not great. So, but I don't have enough information to comment on that. The New York City subway system ventilation system is quite good. I have not been able to determine PATH or New Jersey Transit, and I know there are people on this call from the Port and New Jersey Transit. Maybe they can offer some suggestion or information on that. We haven't been able to document any cases on regional rail. It may be, again, people are wearing masks, people aren't talking to each other. The ventilation systems may be good. I don't know enough about the ventilation systems on that. On buses, I would recommend, while the weather is decent, if the ventilation system doesn't meet the levels that I spoke about, then perhaps keeping some windows open would be a great advantage.
And then,
Hey, Sam.
go
I'm
ahead.
sorry, this is Jeremy Colangelo, New Jersey Transit, just to jump in on that. Yeah, thank you. So, right, buses do tend to turn over air multiple times an hour. Trains, it's a little different depending on the type of equipment specifically, right? At NJT, we have multiple different types of equipment, but you do get air turnover there as well. We are, of course, continually looking at, opportunities to enhance air filtration, working with a variety of partners on those things going forward. And so we'll continue to do that. But I think the point made here was a good one, which is that you do have that sort of turnover in transit vehicles. And as was noted as well, it's really a big part of this is about, in my view, I think, in my organization's view, around folks acting responsibly on board and at facilities. So, the mask is clearly a thing that is tremendously valuable. I'll note just anecdotally, there's been some other research done around areas which have or have not had higher rates of infection, and a correlation, I think, has been made in various cases to just the general population wearing masks, not on transit specifically, but just in general. So communities that were perhaps culturally more accustomed to wearing masks did see lower rates of infection, et cetera. And, it's clear that it's a simple thing that can be done to protect yourself and to protect, frankly, your neighbors and anyone else you come in contact with. But on the transit side, certainly air does turn over with some frequency in any vehicle, and we are continuing to look at opportunities to enhance and modernize filtration to the degree we can. Obviously, we have some equipment that's relatively old, and we continue to look at upgrading, the filtration there as well as, of course, the tactile cleaning and everything else that we've been doing and will continue to do. So I just wanted to add that perspective as well. Thanks.
And then, so Ken Wadeen has two questions. One kind of builds off of, I think, what Jeremy just mentioned with the cleaning. He's asking how the use of cutting-edge cleaning technologies on public transit is impacting the spread of COVID-19. And then he also had a question specifically about rail commutes from Fairfield, Connecticut, and whether their COVID-19 rate is also low.
Okay, on the first one on the cleaning, right now, the science seems to indicate that about 90% of the transmission or more is likely through aerosols or or droplets, meaning particles in the air. The droplets are larger particles that tend to fall to the ground when you sneeze or you cough, and the aerosols tend to stay in the air a little bit longer. Fomites, the transmission of the disease by touching a surface appears to have a much lower incident in terms of transmitting this virus. Nonetheless, I believe just about every transit system is doing a really good job, from what I hear, in cleaning off fomites or disease from the surfaces. And if you are wearing a mask, don't touch underneath your face. If you're touching surfaces, when you get to your destination, wash your hands, or if you have a cleaning agent, do that. I think we may have emphasized the cleaning of surfaces too much, but too much is not a bad thing. But I believe that more of it is being transmitted through aerosols. The second, and the aerosols, there are some treatments that haven't been proven yet, ultraviolet and other kinds of treatment to kill disease while it's in the air, or particles, viral particles in the air. I don't think the science is in on yet on whether they fully work, but it's certainly evolving, and a number of transit systems are using that kind of technique for aerosol particles. The second question I didn't quite follow is something about Connecticut.
Yeah, it just says, what about rail commutes from Fairfield, Connecticut? Is their COVID-19 rate also low? I don't know if that was one of the examples in your chart.
Yeah, Fairfield, I think, was higher than New York City. It was similar to many of the other areas, but I don't recall it directly.
Those were all the questions we had in the chat box.
Is there anyone in the public or our board members that wish to ask a question? Well, Sam Schwartz, I can't thank you enough. Very interesting. And clearly you indicate it's safe to be on transit, but that we must continue to do what we do, and that is to wear masks and constantly wash our hands. Thank you for your input this morning. It's very much appreciated.
Thank you very much for inviting me, and have a good day.
Thank you. Thank you. We'll move to the public participation of the meeting. So please request to comment or ask questions in the chat box, or wait until we call for comments from those of you who are on the telephone. Also, please remember to mute yourselves when you're not talking. And as a reminder, we advise members of the public that we have a 3-minute time limit on comments. The time will display on the screen while each person is speaking. Ted, have any members of the public signed up in advance to speak at today's meeting?
No, Chair, we didn't have it sign up in advance.
All right, thank you. So if anyone wishes to speak, let's start with anybody who is here on the computer. Does anybody wish to speak? What about members of the public who may be on the telephone? Well, thank you. I'm not used to not hearing too much from the members of the public. We always invite their participation. I want to thank everyone. We had quite a few attendees today. We're really seeing very heavy participation to call in and participate at our meetings. And I want to remind everybody that the next meeting of the NJTPA board will be held on Monday, January 11 at 10:30. Login details for that virtual meeting will be provided as we get closer to January 11th. May I have a motion to adjourn?
So moved.
Motion.
Motion moved that, and do I have a second?
Second.
I'm sorry, was that Passaic or Middleton? Was that Passaic who first said second?
It was
sounded like
It could be. I think we're all in agreement.
Okay. Beverly, do you have any other comments? Did you get everything?
There was one question that Trevor Hauer had for DOT about the status of a project, or funding for a project.
Yeah, hi, this is Mike Russo. I made a note of that. I don't have an answer to that. But I will certainly follow up with staff and get back with a response.
All right, thank you. Is there anything else?
Nope, don't see anything else.
Okay, well, thank you. Since we had a first and a second, then I thank everyone again for participating. We will see members next month at our committee meetings, and of course in January for our January board meeting. Thank you very much all, and have a good day.
Thank you.
Bye.
Thanks, everyone. Bye.
They can't run fast enough.
Right.